Yeah, most people who said that they had experience with it were like, it was the best thing I've ever done. My child went on this. It was the best thing they ever did. So I think most people that I've talked to have been very, very happy with their experience on it. But it is those people who have something scary to say. It's a scary thing that they want to talk about. So
the decision to go on Accutane is not one to be taken lightly, but when you are an adult suffering with acne, especially if it's been going on since your teenage years, Accutane might be a reasonable option. A friend of mine, Jen Hamilton on TikTok, recently made that decision for herself to go on Accutane after years of struggling with acne, starting in her early teenage life. Today, I sat down with Jen to discuss her history treating acne, all of the things that she has tried, and why she made the decision to go on Accutane and what misconceptions she had to overcome about a course of Accutane, and ultimately why it was the right decision for her. Just because it was the right decision for her doesn't mean that it's the right decision for you, but I wanted to get her experience and give my perspective on a course of Accutane, both as a dermatologist who prescribes it frequently and as somebody who has taken it personally. I hope you find the conversation educational and entertaining. Jen is great, and you should definitely be following her on YouTube, on TikTok, and on Instagram. She makes amazing, highly relatable content that I'm sure you will love. So welcome. Thank you for sitting down, Jen. I'm really excited to have this conversation about kind of what you've been up to with skincare recently.
yeah, I'm super excited to be here. And I am happy to be that person for someone else who may be considering it, so they can kind of follow along with me and I can be the guinea pig for them, because I know that it's a tough decision sometimes to go on a drug for acne.
Yeah. I want to say you tagged me in a video maybe 4 to 6 weeks ago when you were like contemplating going on Accutane. You had your dermatology appointment coming up and you're like, I think I want to do this, but I'm not sure. What does everybody think? And what kind of feedback did you get on that video? What were people largely supportive or like, hey, don't do it, it's crazy?
I would say 90% supportive, and then the 10% that were afraid, I'll use that word, were very, very loud and sometimes obnoxious, like commenting on everyone's positive post saying, no, don't do this. So yeah, most people who said that they had experience with it were like, it was the best thing I've ever done. My child went on this. It was the best thing they ever did. So I think most people that I've talked to have been very, very happy with their experience on it. But it is those people who have something scary to say. It's a scary thing that they want to talk about. So
yeah, it's not a benign medication, and going on a drug like Accutane has to be, seriously considered, the pros, the cons, and it's a discussion that you should have with your doctor and not just random internet strangers. But it's always good to hear other people's experiences, which is part of the reason that we're talking. So to back up a little bit, the decision to go on Accutane is usually one that's made out of frustration after a lot of time not really controlling acne with other methods. So what is your history with acne? How long have you dealt with it? And what are some of the things you've done before you cross that bridge of let's go on Accutane?
Yeah, so I started having trouble with my skin around the time that I started puberty. So like 11 or 12, I remember like my first zits or my first pimples. And no one else in my family has struggled with acne. Not one of them. Everybody's got great skin. And so I felt very frustrated growing up with acne because, my mom would take me to the dermatologist and we would try, I can't even tell you how many topical treatments. We did many courses of antibiotics. I remember one course specifically, I got put on doxycycline and I ended up with esophagitis from it.
Ooh, took it before bedtime.
Yeah, that was not a fun time for me. So basically what esophagitis is, it's the swelling of basically the tube that takes your food from your mouth to your stomach. And so it felt like there was like a big piece of steak in my throat that I couldn't swallow down. And I actually had to reschedule my nursing licensure exam because I had esophagitis and I didn't feel like I could focus because I was so agony with this esophagitis. I have done Proactive a few times, and it would start to work after like a really, really rough patch of taking all my skin off. And then it was like, if you weren't using it perfectly, it would come right back. It was frustrating to have to buy it continuously. And let's see, what else have I tried? I've also done Curology. Curology worked while I was on it. And it was the same kind of thing with Proactive. I was just so tired of having to buy new stuff. And so during this time of trying all these new things, my dermatologist was like, let's just do Accutane. Let's just do Accutane. She said, everyone in this office has either had been on Accutane or their kid has been on Accutane. Like, it is not that big of a deal. But my mom is a nurse and is a very big researcher. So, you know, going online and looking for, you know, side effects and stuff, it's got some scary stuff attached to it. So she was always like, oh my gosh, please don't do this. I don't want you to be the one that gets this, you know, these awful things that happen to you.
Sure.
So I was kind of scared away from it for a very long time. And over the last year or so, I've done some, you know, personal things for myself to make myself feel better. I got a mommy makeover. I got braces, you know, all these other things. And I was like, I just want to fix my skin, you know, like I can put makeup on top of it, but it doesn't fix the problem. So I was like, I think I'm going to do it. And then I tagged you in a video because you and I have been friends on TikTok for a very long time. And I think I said, am I making a mistake? Or something like that. Is this the right thing to do? Because I trust you in what you say. And I knew that you would have one, you know, some sort of opinion on it since this is your field. And so I will say that you saying that it was a very valid choice to do for some people. It kind of gave me the confidence to go to that appointment and be like, okay, let's do this. I'm ready.
Yeah.
So, and I think kind of some of the things you said, you documenting your journey with all the things you've done for yourself. I mean, you make, I think, hilarious, relatable content where, you know, you've talked about having braces, you talked about the mommy makeover, of just wanting to be your best self, but you've done it in such a way that would never make anybody else feel like the decisions you made are the right decisions for everyone. And I think that that's important, that you're just very validating to other people that whatever decision you want to make, you should be taking care of yourself in the way that makes you feel good. And people like that. And so when you made that decision to go on Accutane, it was very congruent with the attitude and content that you put out on social media, which I thought was phenomenal.
Well, I really appreciate that. That's my goal, is to kind of share my journey without, you know, forcing my journey upon other people, because we all have different experiences and, you know, we're not always going to have the same answer for the same problem. So, yeah, thank you for saying that.
Yeah. Now, how old were you when your mom was telling you, no, don't go on Accutane?
I was probably like just entering high school. Okay. So you're, you know, all the beautiful popular girls at school have great skin, and I'm not in that boat. And so I remember being at the dermatologist and they mentioned Accutane, and my mom was like, absolutely not. Well, you're not. No. Because they started talking about the process. Like, you know, we can put you on this drug that works very, very well for acne. But, you know, there are some steps that we have to do in order to get you on this. And I really didn't fully understand that process until we really were taking the step to do it. I was like, dang, there's a lot of stuff that has to happen.
So were you personally scared about the potential side effects or the things you'd heard? Because obviously you didn't do it as a teenager, so you had maybe presumably some of those apprehensions to overcome as an adult when you made that decision to do Accutane.
Yeah, so I was aware of two of the major things. So obviously getting pregnant on Accutane is no. We do not want to get pregnant on Accutane because it's so toxic to a fetus.
Right.
And we knew that we were done having children, so that one wasn't, you know, that big of a deal to me. But then the other one that I was acutely aware of was the kind of gastrointestinal situations that can happen. I have a friend who has ulcerative colitis and kind of attributes that to being on Accutane. So those were the two things that I was aware of. And then after sharing some of my thoughts about starting Accutane on the internet, other people would say, oh, well, my mood was terrible, or I had terrible thoughts, or there were all sorts of stuff that people were saying that they attributed to Accutane. But yeah, those were the things that I knew of for sure before starting.
Right. And, we don't discount anybody's experience, but anybody watching from a dermatologist perspective, just to provide reassurance that they've done large, cohort studies looking at, thousands of people who've taken Accutane, and they didn't show that the baseline risk of depression, ulcerative colitis, or Crohn's disease was higher in the Accutane population than it was in the baseline population who had not taken Accutane. Now, there's always going to be anecdotal reports and individual experiences that may weigh heavily because a personal experience from somebody that you're friends with, it's personal. It makes you think. But when we look at general population statistics, which is what we have to make medical decisions on, we don't see an elevated risk of any of those conditions in people who take Accutane versus people who don't. So just to provide some comfort, but again, if you know somebody that's been through it, it definitely is going to weigh differently on your mind.
For sure.
So you made that decision. How long have you been on Accutane now?
Tomorrow will be day 10.
Okay, so real new.
Real new. And so the process, just starting out, I wasn't expecting to see really much of any difference for maybe 1 to 2 months. And I'll say that I'm noticing some very small changes in my skin starting out. Today is the first day that I really feel dry. That's the thing that I'm noticing right now. I had taken a nap before our interview tonight, and I got up and I was just going to refresh my makeup so I didn't look like I had really bad acne on here. And I wiped my face, and I'm getting the little skin beard all over, just the little fuzzy skin. So yeah, dryness is kind of what I'm feeling here, and just the newness of it.
Yeah, very good. I was going to say, day 10, your lips just started getting chapped today.
That's exactly right.
What kind of skincare products did you get to go along with your Accutane journey? Because you want to, of course, get rid of all your other active stuff. So what are you using right now? So
really only CeraVe products. And right now I use the CeraVe facial cleanser. I think it's a foaming cleanser. And then just for washing my face. And then I use a morning and an evening moisturizer on my face, because I'm trying to pregame the dryness a little bit, trying to prevent as much as possible. So I'm trying to keep my lips and my face moisturized as much as possible, and Aquaphor for my lips.
I love it. That's all great stuff. I was going to say, if you didn't have good stuff, I'll just talk to somebody that I know at CeraVe and see if they'll send you more good stuff and just load you up.
Yeah, tell them I will be happy to boost them up online, because that's totally what I use.
I'll see if I can pull some strings. So,
okay.
I want to just comment on a recent TikTok that you posted, maybe just a day or two ago. One of the things you have to do, you mentioned you cannot get pregnant while taking Accutane, and I want to clarify, you should not get pregnant when taking Accutane.
Yes, that is a good clarifier.
I once gave somebody a prescription for spironolactone, which is a blood pressure medication, but has the potential to cause birth defects as well, particularly if you're carrying a boy. And I said, you can't get pregnant while you're taking this. And they took that to mean, I can't get pregnant, meaning this is going to be birth control. And I was like, no, you should not attempt to get pregnant. So that's a clarifying statement. It's dangerous to get pregnant while you're taking it, so it requires 2 forms of birth control. And I don't know if your husband watches your TikToks, or maybe we'll spoil it on YouTube, but but you had a conversation about that second form of birth control, and he volunteered to get a vasectomy. And your conversation with your nurse at the office was hilarious. I don't know if you want to rehash that.
Yeah. So as I said before, Brian and I have been done with kids. We're good. We're good with 2. And so going on 2 forms of birth control. I already have an IUD, so that's my one form. And I know some of the other forms that are acceptable, such as condoms, such as other barrier methods. There's other things that can happen. But I seemed very sad that I would have to take another form of birth control. He said, okay, I'll get a vasectomy. I was like, yeah, because he had already said that he would, but I was thinking that this might, push him a little faster. Like, let's go ahead and get this done. And so whenever I went to get the prescription, we have to go over the 2 forms again. And so I said IUD and vasectomy. And she said, oh, does he already have one? Or like, he's not getting it for this, right? I was like, oh no, he's getting it for this. She said, honey, you don't have to do that. I said, I hear you loud and clear that you said he needs a vasectomy. Yes. So yeah, he knows that awesome. I'm playing him a little bit, but
that's okay. That's okay. No, sounds like you've got a great supportive husband, and you guys make good content on TikTok. So, I'm excited to watch your progress, watch your TikToks as you talk about it, and would love to kind of follow that journey. I'm sure that people watching this who are interested in Accutane or maybe taking it would love to kind of have a progress update in a couple of months and just kind of watch how things go for you.
Yeah, and I would love to show you my progress as well. So, because I'm excited to see it too. And I'll be happy to send you some photos of like before and stuff. Because right now I got this like beauty filter on the computer and it looks so smooth and so great.
Yeah, people are going to be like, why does she need Accutane?
Yeah, what is this girl talking about?
So, yeah, we'll use some of those on the thumbnail and everything. But I think it'll be helpful for a lot of people. I don't know if there's any other things you want to mention about your decision to go on Accutane. I know that a lot of it is new to you still, being only 10 days in.
Yeah, I would have loved for somebody to talk about the process of actually getting it, because there's a lot of hoops to jump through. Are you okay if I talk about that process?
Yeah, I think that'd be helpful because it's different for men and women.
Yeah. So because I'm a lady and I have lady parts that are of childbearing age, there's a lot of things that have to happen in order to prevent pregnancy while you're on Accutane. So in order to get the prescription for Accutane, you first go to your dermatologist and talk about it, that you would like to start the process. At that appointment, they took a urine sample of mine to make sure that I'm not pregnant at the time. So I had to have a negative pregnancy test at that appointment. I also had to sign lots and lots of papers saying that I understand that I should not get pregnant while on this drug. Past that, 1 month later from that appointment, I was able to go and get lab work drawn. And Dustin, you may be able to say exactly what they're looking for on there, because I have no idea.
Yeah. But so most of the time we're going to check your liver to make sure your triglycerides and cholesterol are normal and your liver enzymes, because Accutane is metabolized through the liver. So it could elevate your liver enzymes and it could elevate your triglycerides. So we like to get a baseline on that. I don't check it every month, but some dermatologists might.
Yeah. So you have to get that lab work done. And then once that lab work comes back and looks great, I then had to go back to the dermatologist to get another pregnancy test in the office. They did another urine dipstick. And then at that point, I was able to get the prescription that they wrote out. But you still have to, if you haven't already, go online to something called iPledge, which is just another form of making sure that you are well aware and understand that getting pregnant on this drug could have catastrophic effects on the fetus. Yes. So, and then you can take it. Then they give it to you. And I do think it's funny that on the packaging for each Accutane pill, there is a picture of a pregnant lady with a no sign in front of it, like no pregnancy. So on every single day, you have to look at it and say, okay, I'm not getting pregnant today.
Yeah. It's not an easy thing to get out of the package. I've taken Accutane myself, and whether you're a male or female or whatever, opening that package every time, it's the same for everybody. And so it's like, you're not going to take that pill accidentally, like if you have a headache or something.
No, absolutely not. And they also told me that I should not take other drugs that are metabolized through the liver, because that can cause extra stress on your liver.
Did they recommend anything about alcohol consumption? I don't know if you drink at all or not.
I don't drink, but they did say don't do it.
Yeah. That's sound advice. That's what I tell my patients as well.
Yeah.
So I'm excited to see where this goes for you. Follow your progress on TikTok. I'm going to link your socials in the video description, but tell everybody where they can find you, follow you, and support you on social media.
Yeah, so if they just type in Jen Hamilton, if they just search my name on TikTok or Instagram, I should pop up. On TikTok, I do have a blue check mark beside my name, so you do know that it's me. But it's _Jen_Hamilton_ on all the social medias.
Awesome. So I'd encourage everybody to go follow and support Jen. Her content is amazing, very genuine, and she's definitely going to entertain you and educate you. So, but thank you again for coming on here, giving us an introduction about what it's like to start Accutane as an adult to battle adult acne. I'm excited to see your progress.
Well, thank you so much, Dustin, and I cannot wait to come back and show you my face, maybe with no makeup next time. Maybe I'll just be like...
No makeup, no filter.
No filter, no makeup, no nothing. I'll just show you what it looks like.
Sounds great. Thanks, Jen.
All right. Thank you so much.